Welcome everyone. Good morning. Thank you for joining us today. Teresa Marintet is not in today at the office. My name is Dr. Wajid Ahmed. I'm the Medical Officer of Health for Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you're sick. Maintain a 2 meters distance from others. Wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeves, and wear a mask when you cannot maintain a 2 meters physical distance from others. I will now report our current case counts. There are 130,493 confirmed cases of COVID-19 in Canada and 42,686 cases in Ontario. Chatham-Kent has 363 cases, and Sarnia-Lambton has reported 340 cases. Michigan now has 104,395 cases, with 13,716 cases in Detroit alone. Today we are reporting 2,542 cases of COVID-19, an increase of 1 new case from yesterday. This case is a close contact of a confirmed case. Overall, 26% of our cases are between the ages of 20 to 29 years, and 23% are between the ages of 30 to 39 years. 65% are male and 35% are female. 2,378 cases are now resolved, and 90 cases are active and being followed by our health unit. 17 people are in the hospital, with 1 person in ICU. Our community has lost 74 people to COVID. 52 deaths have occurred among residents in long-term care home and retirement home. There is 1 retirement home currently experiencing a COVID-19 outbreak. As well, there is 1 outbreak in the manufacturing sector. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain if you're feeling confused or losing consciousness. Assessment and testing centers include Erie Shores Healthcare in Leamington and Windsor Regional Hospital Ouellette campus. Testing will also be available at the Sportsplex at St. Clair College on September 3rd and 4th. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit population and their families. If you have symptoms and have been tested, you must remain isolated until you receive your results. To check your results, please go to www.wechu.org and click View Your Result to access the online and result portal. If you are unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at www.wechu.org for the most current information and case count. I will now turn it over to our epidemiological summary for this week. So very quickly, we will just cover all these areas which we've been covering since the beginning of this pandemic, talk about the epidemic curve, some of the regional and provincial rates, and the percent positivity and various distribution by geographic and other factors that we can speak to. First graph showing the epidemic curve by reported date. As we have talked about, the epidemic curve help us assess the progression of the disease, whether we are talking about in a community or in an outbreak situation. This particular epi curve is created to show the number of confirmed cases by the date it was reported to public health. On your vertical axis, you have number of confirmed cases, and on your horizontal axis, we have the dates these cases are reported to the public. This figure includes all cases, that is cases in the community, cases in the long-term care home, retirement home, and in the agricultural sector. Day-to-day variation can vary significantly, and we know COVID-19 do not cause disease after exposure immediately. Another way to look at it is to look at the 3-day moving average. Looking at the 3-day moving average, it captures the day-to-day variation in a much better way. What we can see is we have seen a significant increase in the number of cases in the month of July, but now we are trending to somewhat, which was relatively a baseline for our community. This graph looks at the cumulative cases of COVID-19 in Windsor-Essex County. The steep in this graph represent the high number of cases in a short period of time. But what we can see right now is the cases has remained relatively low in the past month, and now leading to a general stabilization of cases of COVID-19 in Windsor-Essex. This figure further breaks down the cases by agriculture farm sector versus non-agri-farm. Outside the one day recently, we had a large number of cases from the agri-farm sector, but now our cases are mainly coming from the community. In the past week, there have been no farm cases reported in Windsor-Essex County. One of the common methods of looking at how we are doing is also using a 7-day moving average to look at our overall trend. The blue line indicates all of our cases using a 7-day moving average. We see a peak in late March and April, and then the latter is attributed to the outbreaks in the long-term care home. In the past month or so, we have seen our cases in the agri-farm sector, but in the community cases that were relatively low in the most recent time. The green line looks at the 7-day moving average if we were to remove the workers in the agri-farm sector. The slide captures the week-over-week incidence rate per 100,000 population from week 18th, which is April 27th, to our current week, week 36. We saw a dramatic increase in cases in week 26 and a second peak in week 30th, which are primarily attributed to the agri-farm sector. We are seeing continued decrease as of week 36. Please note that week 36 is still in progress and ends on Sunday. With respect to the number of cases, the number of people who are tested locally and the positivity rate of them coming back. In total, in Windsor-Essex, 85,502 tests were completed. Out of these, 54,424 unique individuals were tested as of August 29. Looking at all tests, our current person positivity is 1.1%, which is represented in the orange line in the graph. If we are looking at unique individuals that tested positive last week, this is closer to 1%, which is the red line. Last week, approximately 811 tests were completed daily, and 801 unique individuals were tested daily. Windsor-Essex has the highest rate in the province with respect when it comes to the rate per 100,000 population case. For us here locally, we have experienced a higher proportion of cases in the long-term care and retirement home, currently 13%, but at its peak, this was 42%, including staff and residents. And are currently seeing an increase in the number of individuals in the agricultural sector who are ill. Approximately 46% of our cases came from that sector. Looking at rate per 100,000 by each of the municipality, what we can see is Leamington and Kingsville continue to be have the highest rate per 100,000 cases in the region, while the rest of the smaller municipalities have relatively similar number of case rates per 100,000 population by municipality, and Windsor lies somewhere in the middle. This map displays the rate per 1,000 residents by dissemination area. The areas with no color are places where there have not been any lab-confirmed cases of COVID. Please note that the scale that is used in this map range from 0.5 cases per 1,000 to 368.2 cases per 1,000. The scale will change in each map and is relatively comparison to the cases in a geographical distribution. As you can tell from the previous slide, in Leamington and Kingsville, the darker colors, blue and purple, indicates higher cases in those specific dissemination areas relative to the county. Rates are low in the city of Windsor. Yellow or lighter version of yellow indicates low rates of COVID in these specific areas. Please note that this does not mean that these are the cases which were infected in this specific dissemination area. Rather, it represents where these cases reside. Cases may have been exposed to COVID outside of their home or in any other setting, but just because of their residential address, it is reported by that in this map. Zooming into the city of Windsor and looking at the rate per 1,000 resident, once again, areas with no color are where no lab-confirmed cases were identified. As described in the previous map, this map is comparing the cases only in Windsor and the scale is from 0.8 cases per 1,000 to 27 cases per 1,000. Certain pockets had higher rates across the city, and looking at the number of active cases in Windsor-Essex, Windsor-Essex County, this is what it looks like. As expected, the rates are higher in the areas of Leamington and pockets of Windsor and LaSalle, but overall the number of active cases in the region are relatively low. Zooming in the city of Windsor, the number of active cases, this is what it looks like. Most of the cases, we can see the pockets across the city, like in the West End and in the South Windsor area. Please note that this does not mean that these are where the cases were infected, rather than where they live. Cases may have been exposed to COVID outside of their home and in any other settings. Looking at age and sex distribution of cases in our region, the green line represents overall distribution of cases in the region, whereas the blue line represents cases in the last 2 weeks. Overall, we have seen more male cases compared to female, but this number is disproportionately high in females within the past 2 weeks. We have seen a large number of children between 0 to 19 who contracted COVID-19 in the past 2 weeks compared to what we have seen overall since the beginning of this pandemic, which is somewhat concerning, knowing that the schools are opening is right around the corner. So we definitely like to keep a close eye on that and remind residents and parents to keep a close eye on your children and any gathering, any activities that is happening. It should be discouraged and it should be followed by public health measures, including the limit physical distancing and how people are interacting, and ensuring that all the public health measures are in place when your children are having any gathering in small numbers. This looks at the overall case count in Windsor-Essex by each of the municipality. Overall, 35% of our cases have been from Leamington, 33% from Windsor, and 23% from Kingsville, which makes up 91% of our overall cases in the region, while the rest of the municipalities make up 9% of our entire cases in the region. Zooming further in the last 30 days, this is what it looked like. 40% of our cases were from Leamington and 31% from Windsor, and 9% from LaSalle, and another 9% from Kingsville. Zooming it further in the last 7 days, this is what it looks like. 58% of our cases are from Windsor, and 13% are from Leamington, and 11% from the town of Essex. Looking at the past 7 days again, there have been no Agrifarm cases as we reported, but what we're seeing more cases in the community, especially exposure among close contacts, and one of that cluster we reported in the last couple of days. When we are looking at the epidemic curve by reported date by each of the municipality, City of Windsor, which has seen a significant number of cases, this is what the epi curve looks like for the City of Windsor. We have seen a significant spike in 1 day, but then overall the rest of the days were relatively stable, and the yellow line shows the community 7-day moving average, which started to creep up just because of that single day spike, hoping that it'll go down again to somewhat which we can expect as baseline with the city of this size. This is what it looks like for the town of Amherstburg. This is what it looks like for Essex. They've seen some cases with the overall moving average and the community average. We've seen a spike in the last 7 days, and hoping same that the spike will go down to what is their baseline. Looking at Kingsville, this is what it looks like. Kingsville has seen their fair share number of cases, mostly attributed to the farming sector, agri-farm sector. But as I mentioned, that there are no recent cases or no new cases among farm workers, and that's why we are seeing that their overall community moving average and overall moving average is going down significantly. Looking at Leamington, similar picture with some huge spikes earlier on, but now stabilizing with some occasional spikes in the cases. But overall, in the last 7 days or last a few weeks, these cases are relatively stable in the town of Leamington. Looking at Lakeshore, this is what the picture looks like with some ups and downs, getting back to something which is relatively closer to their baseline. Similar picture in LaSalle. We've seen a significant uptick in the last week and now trending downwards. Hopefully the trend will continue to something which should be their baseline. Similar picture in Tecumseh. We have seen some cases in the Tecumseh, but overall, when we look at the actual number of cases, we have seen relatively low number of cases in the town of Tecumseh, and hoping that it will go back to where it was before, with no to very few cases overall in the town. Looking at the exposure date by reported case, so what we are seeing is we see that earlier on it was imported to Windsor-Essex via travel, but from then we saw some cases in the community, but predominantly spread through close contact. And now what we are looking at is also some cases as a result of travel, which we are hoping that we can bring it down to zero. And when we are looking at the community transmission, which is reflected here by yellow-orange stack, it's relatively low in the last couple of weeks, and hoping that the trend will continue. We've seen some spikes, mainly resulting from close contact, which we attributed to the recent community cluster that we investigated. The slides look at the exposure of Agrifarm sector since the middle of May. While the majority of cases have primarily acquired through illness through close contacts, we have seen some instances where community acquisition happened, but most recent are cases in the Agrifarm sector are attributed to travel. This figure looks at the non-Agrifarm sector since June. While most of the cases are close contact, we are seeing cases acquired through community transmission, where cases are unable to identify a close contact, nor it being linked back to the travel. Some of our recent cases have been due to close contacts and tied to the community cluster we've been investigating. But in the recent weeks, most majority of these cases are as a result of close contact. Among healthcare worker, what we have noticed is roughly 1/5 of our workers' cases in Windsor-Essex among healthcare worker are from healthcare worker that works in Michigan, but 80% of our workers are generally healthcare workers are local, and they work here in Windsor-Essex. Fever, cough, headache continues to be the most dominating symptom for COVID-19. Please note that an individual can report more than one symptom, and that's why these numbers may not add up. Looking at the hospitalization and ICU rate for COVID-19, this is what it looks like. Cases in the ICU have remained relatively low for a while. The red line indicates a 7-day moving average in the ICU, showing a decrease as well as in the last 7 days. Hospitalization have fluctuated more so than the ICU. We are seeing once again a surge in hospitalization. This is primarily driven by an outbreak at a retirement home, which resulted in transferring of some of their patients from the retirement home to the hospital setting. And this is also reflected in the 7-day moving average, which is represented in the orange line. Looking at the health system capacity as an overall, the orange line highlights the occupancy rate of our acute care beds. The threshold is to have the occupancy rate below 85%, which we are just meeting. This signals that while we can meet the demands related to COVID, we are going to be stretched if capacity is not decreased. The green and dark blue lines are for the ICU capacity and ICU ventilator beds respectively. For ICU capacity, we look at the overall ICU capacity and ICU ventilator beds. While there is no established threshold, overall we are aiming to be less than 50% for overall ICU beds capacity. Higher than this may lead to stress to the healthcare system if COVID-19 continue to increase within Windsor-Essex. So where we are with all these cases, the good news is almost 94% of our cases are resolved, and approximately only less than 3% of these cases are currently self-isolating. Unfortunately, we also lost 3% of our cases to COVID, and we have seen minimal cases in the hospital and or ICU. This is the graph that was requested by Maureen from Blackburn, and this is what it looks like in terms of ever hospitalized. Only 9% of our cases in the region were ever admitted to the hospital, while 91% of our cases recovered well in the community with minimal follow-up from the rest of the healthcare system. Looking at the age and sex breakdown of COVID-19 death, this is what it looks like. And overall, more female died with COVID diagnosis compared to male. From an age distribution perspective, almost 70% of the death was in individuals who were 80 years and older, and the youngest person who died in our region was a man in his 20s. Looking at the overall case fatality rate, and this particular group graph shows that what it means for an individual who contracts COVID-19. In our community, the overall case fatality rate is 2.9%, while in Ontario, the overall case fatality rate was 6.6%, which is higher than our regional average. In the long-term care home across Ontario, the case fatality rate is higher in the province at 21.3%, whereas in Windsor-Essex, it was lower and was at 15.2%. Looking at the case doubling time day-over-day variation comparison, we have seen significant jump in our day-to-day comparison for doubling rates in Windsor-Essex. More recently, we have been above the provincial average, and being above the provincial average from a case doubling time, it's a good sign, good indicator. That means our active the case replication in our community takes us much longer, which is a good sign compared to the rest of the province. But overall, what we are looking at in the region is still stabilizing of the effect, with some cases going down in the case doubling rate going down in the province as well as in Canada. The most recent estimated mean R0 is 0.83, and when the R0 is less than 1, every infection caused less than 1 new infection, signaling a decrease in the virus in the community. When the R0 is greater than 1, each existing infection causes more than 1 new infection. Our R0 estimate varied greatly due to the influx of cases from the Agrifarm sector, but in the recent days, we have seen a decrease across all of Windsor-Essex, and the shaded area demonstrate the variation or the error we can see appreciate in the graph. So in summary, what we can say is Windsor-Essex is seeing low number of cases overall, which is a good sign. The primary source of exposure continues to be close contact with a confirmed case, which is something that we definitely want to focus on in terms of reducing the number of contacts in the community. And some of the recent community cluster that we have seen were all a result of close contact, highlighting the importance of the social bubble, the concept of 10 people that can be in your close circle, that if one person is affected, it does not infect the entire community in some ways. But having multiple social bubbles, it basically defeats the purpose, and it can lead to significant increase in the number of cases in the community. COVID-19 related hospitalization has increased, but a majority of that increase is because of the transfer that happened more recently in the community from a retirement home to the hospital to support the retirement home from moving into from moving some of their patients to the hospital setting. But the overall ICU capacity continues to be low. Day-over-day doubling time in Windsor-Essex is on par, and in some days it's better than the provincial and national average. The overall R0 effective rate value is 0.83, which is indicating that the transmission in the community is declining, and we'd like to continue to see that trend, and we like to see that R0 continue to go down in the community to have a better handle on the spread of COVID-19 in the community. Thank you.
The conference is now unmuted.
And I'll take questions from the media. Any questions from CBC?
Yes, hi Dr. Ahmed. I'm just wondering, are you going to be, is the health unit going to be hiring or assigning nurses for schools, whether to be there to help them out or specifically with tracking school outbreaks if that happens?
So our health unit is already in the process of recruiting the school nurses that were allotted to us by the ministry, and the exact role and details are still being worked at in terms of how they will support the schools. But those nurses were recruited, are being recruited right now to support the school in the Windsor-Essex area.
And do you know how many nurses are going to be recruited?
I believe 19 nurses are allotted to our health unit based on our size.
And then I know you were saying that there's been no Agrifarm cases in the last week. Are you able to provide like an update on kind of what's happening there in terms of testing, outbreaks or anything like that? It's a good sign, I guess, that cases have not happened in that sector this week.
So we are obviously, the purpose of this epi-summary is to share that detail. So all that detail that I'm sharing, it's what we have is we already shared. In terms of the overall strategy, overall testing, I think that's something that we are not necessarily involved directly with, but all of that effort and initiatives are ongoing. Not to say that when we are not reporting this case, we are not talking to the Agrifarm sector. Our team is already always in contact with them and the other broader group that is working regionally to support the Agrifarm sector, especially from the purpose of isolation and their accommodation. So that group is also working. So there are a number of conversations that are happening at different tables. The overall impact of all those efforts that we have done in the last couple of months that has resulted in having a better system in place to support the Agrifarm sector in the region and ensure that the workers, if they are infected, how best we can support them by isolating and how we can prevent further transmission in that sector. So our overall, that is all going well, and I can't report more than what I've reported today.
Okay, that's great. Thank you so much.
Any questions from AM 800?
Dr. Ahmed, with yesterday's community cases and the one today, has the health unit determined if that's part of the cluster yet?
Some of these cases are part of the cluster. I will provide another update on the cluster on Tuesday. As we speak, a lot of that data is collected and collated to make sure that we are getting, we are further reducing the spread. And I think, again, people feel differently, people think differently. When we are talking about this cluster, it's not about stigmatizing anyone. It's not about singling out any single individual or group of people. It's not about that. It is about the safety of the community. I think we all have to do our part. The purpose of this investigation and reaching out to all of these individuals is to prevent further transmission. And maybe there's a different understanding. People think differently in terms of how diseases spread, what is their role. Some people think, I know everything, I can take care of myself. No, you cannot. And I think there is that level of social obligation. That's the first thing. And then the second part is the Health Protection and Promotion Act, which basically prevents individuals or give us the authority to investigate all these cases to prevent the spread of disease in the community. So there are a number of things that are in place, and we want to make sure that we are supporting everyone, first of all. So anyone who is sick, we are supporting them. And then anyone else who is at a risk of developing the disease, we are supporting them as well. So I think the idea is not in a negative sense. When we are doing that outreach, when we are making that connection, is to get their compliance, is to make sure that we're reaching out to everyone we need to, and we are containing it before the school years begin, before we get to a situation where the community spread is low. So that's our goal. We'd like to see those numbers going down. We'd like to see very few cases or almost zero cases in the community as soon as possible.
Dr. Ahmed, on Wednesday, when you talked about the cluster, at that time you said 19 confirmed cases are in the age bracket of 10 to 19 years old. Today, you mentioned the last couple of weeks that age bracket, the number is going up. With school around the corner, who will give the green light for that age bracket if they do attend school? Who gives them the green light to go back to the classroom? Would it be the health unit, their family doctor? Who approves that?
So any of those individuals who are part of this cluster, we give them a go-ahead. We give them a green light in terms of them attending that school. And that is why it is important that we get in touch with everyone. And again, it's not about me. It's not about anyone else. I think it is about the safety and well-being of our entire community, of our schools. And it is in our best interest to have that connection. And what I can speak from my team is that we do respect everyone's privacy, and we never, none of my conversation, and I've been in the middle of many questions that have been asked about sharing many of those details. And I stood here respecting everyone's privacy and confidentiality, which I continue to do. So the purpose of all of this outreach and connection is to make sure that we are doing our job, which is supporting the individuals who are currently sick and preventing and reducing the spread of disease. That is what we are trying to do. There is no other purpose. There is nothing else that we need. That is the only purpose. And in order to do that, there are a number of things that we need. And we definitely want anyone who has come in contact with this cluster to reach out to us. We are doing active outreach as well. We are taking a number of measures to get all those people contact information so we can contain them. And similarly, our request to the community is if you are part of any of these cluster, any of these events, please reach out to us for appropriate direction so we can keep the community safe.
Sorry, just to follow up on that one, since Wednesday, has the health unit received calls, emails from individuals that think they're part of that cluster?
So we have received number of calls, but most of these calls that we are trying it's being identifying themselves. Some of them identified that they attended these events, and then we made the connection. We did some further investigation. We did further outreach by getting some of those contacts information and then making that connection. So all of that is happening, and I think that was the purpose is, and hoping that this outreach or this example of how a simple, innocent event can lead to a large number of spread in the community. So that's one of the intent. And the second intent is to make sure that everyone who could be at risk of developing COVID or has contracted COVID, we support them and prevent further spread in the community.
Okay, thank you.
Any questions from Blackburn?
Hi, good morning. First of all, thank you for that figure. The reason I ask that, because people continue on the Facebook feed and things like that to say, oh, this is just the flu, look at the death rate of 3%. So I just wanted to see that overall number to see what that figure was. Any comment on that people can still continue to have those thoughts that, that this is no worse than the flu and that we're, blowing this out of proportion perhaps?
Well, I think this pandemic, as we talked about, and I'm not joking when I say that pandemic does cause significant amount of stress, anxiety, and everyone deals with these stress and anxiety in a different way. A lot of people continue to be in denial, which is sometimes it's a natural human reaction. What I can tell you is, what about those 23 million cases and still going across the world? What about those 850,000 plus deaths that happen in the world? And unfortunately, if you are one of those person who lost a family member at an age, probably at a younger age or at an older age, how about those people? So think about it, put yourself in their shoe. And again, respectfully, I don't mean to say that I have I don't know how to put it, but anyhow, the purpose is not to make them look bad. The purpose is to help understand the gravity of the situation and where we are right now. We have a good example when we look ourselves in Canada. We have a good example of what happens in US and the number of spread, the cases, the people who are dying. You are lucky if you haven't contracted COVID. You are lucky if you contracted COVID and didn't end up in a hospital bed or didn't end up dying. But that doesn't change the severity of the disease. Everything that you're seeing, the 9% hospitalization rate, the 3% of case fatality rate in our region, it is because of everything we have done. It's very difficult to show, especially here, what could have happened if we didn't go there. We did some modeling in the beginning of this pandemic. We said what the projection could look like. We have our neighbor right next to our border. We can see what their trajectory is, what happened there, how many people lost their lives. So I think it is almost insensitive to some point when people are saying that, oh, it's just a flu or it doesn't matter. There is a particular group, and I'll just be very open and blunt about it. There is a particular group who is out with this type of message. God knows for what reason, but there is a particular group who's pushing this message. and they are trying to counter all the good public health messaging, which is fundamentally wrong. And we need to counter those messages by people who at least understand how it impacts individual personally and in the communities. We have good examples. So please don't fall into those messages. Please follow what is credible, who is credible. Not everything you're reading on the internet is true. That's just as basic as that. Just because you read it on the internet doesn't mean that it's true. Learn the expert. Expertise doesn't come by Googling internet. Expertise comes from the experts who are working in their specific specialty and specific field.
Perfect, thank you. And just to follow up on some of CBC's questions, when do you hope to have those nurses in place?
As soon as possible. We are in the process of recruitment, recognizing that recruiting 19 nurses in such a short period of time, it's not easy. We need to go through the complete HR process. We need to post it, we need to interview people, we need to get them on board, and then we need to train them. And then we already have some school nurses that are currently working in the health unit. So if needed, if it comes to that point, we will deploy them into that, and then the nurses that we are recruiting, we can maybe mobilize them. So there are a number of ways that we can do, but we definitely want to use that opportunity to recruit more nurses to support our work. And I said this in the past as well, our health unit, if you look at the number of staff that we have and the amount of work that we have done, it's incredible. And thanks to our each and every staff person, all the way from our frontline nurses, our clerks, our public health inspectors, our epidemiologists, our tobacco enforcement officers, our communication team, our leadership team, our management team, everyone has been amazing. The amount of work that we have done, but it's good to get some extra support. So those 19 nurses will definitely add, and hopefully with the additional support, we can we'll continue to do what is needed for our community.
Thank you.
Any questions from Windsor Star?
They have all been asked. Thank you.
Any questions from Windsorite?
Good morning, Dr. Ahmed. I see on the potential public exposures page there are 3 more local businesses added to that. Are those part of that same cluster, or do you have any information on these? I
can't comment on all the specific details, but I am, because yeah, so it may be just some other type of exposure. I can't really comment on it.
Okay, thank you.
So before we go on to the second round, I'd just like to remember our good friend Bob from CTV. I haven't seen him in a while. So hello, Bob. You must be having some vacation time. So just wanted to say hello to you.
Any further questions from CBC?
No, thank you.
AM 800?
Dr. Ahmed, just to follow up maybe to Maureen's question about individuals out in the community. There is another rally planned, a mass free rally tomorrow at Charles Clark Square. Will your team, Windsor Police, be out there similar to the time at Devonshire Mall?
We're always out there, and again, sorry, I had to put my head down. It's disappointing. I think it's just I don't know what these people want, what they're fighting for, and if they're so concerned about their rights, what about my rights? If I want to wear a mask and I want to enjoy a space which is safe for everyone, like what about my rights? And I think it's just getting to the point that sorry, I don't have the words to say, but to answer your question, we'll be out there.
And sorry, one more quick one. Doctor, I'm not sure if you have this on the top of your head, but when was the last time Windsor-Essex had 0 cases? Was it at the end of?
We'll have to get that.
Yeah, we'll have to get that. And the reason I'm laughing is because Nicole, one of our director, we were talking about this today, that when we will get the 0 number again, and maybe Teresa and I, we can do our happy dance on that day to say that we have achieved 0. But we'll have to get back to you on that. don't remember, I think it must be in the early phase of the pandemic. But since then, we have had some days where we only reported one case, but hopefully sooner we'll get to the 0 case someday.
The reason I asked that, because if this cluster going to happen, and you look at certain days where the health unit reports the numbers, it looks like we could add a 0 within the last couple of weeks. Is that safe to say?
Absolutely, and I think every effort that we are putting in together, that's how we will achieve it, and that's why I said that all of us are in this together, and we have to do our part. That's how we get to the point where we can keep our community safe. So yes, you can, and hoping that people use that as an example to move forward, and then maybe do better, to learn from this example and not to repeat the same mistakes.
Thank you. Have a great weekend.
Thank you.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
No, thank you.
Windsorite?
Just to follow up to Maureen's question, one thing that we always see on Facebook too is that people will say that the pandemic didn't get bad here because it's not serious, but they're failing to take into account the fact that the public health measures actually reduce that. What do you have to say about that kind of a situation when people say that?
Well, as I said, first of all, there's one particular group that is actively promoting this message in every forum, in every news outlet, in every, major conversation. However you call it, you want to call it on social media term, some trolls, people are just pushing a specific message out there, and then it just basically corrupts everyone. And in a very good example, one of my colleagues mentioned that when you're talking about, you have a healthy body, and then you get a virus in that body, and then basically it just corrupts the body, and then it just makes everything difficult for that person. So same information, you have all that good scientific evidence, you have good scientific information, one misinformation comes in, and then if there is a certain propagation of that information, then it basically tries to corrupt all the information that's good out there. So that's what these trolls or these messages does. It doesn't mean that it's scientifically evidence-based. People can believe whatever they want. People can have different reaction to certain type of events, certain types of stressors. And anxiety, people react differently. So if you really want to talk about what happened, you have good examples. And I think even you don't have to be a scientific expert to understand everything. All I will say, look at what happened in US, look at what happened in Canada. That's a good comparison. You don't need anything else.
Okay, thank you.
Thank you, everyone.
Okay,
Thank you. Have a good weekend.